So, Doreen, could you just begin by saying your name, and where we are, and if we can remember the date?
12th, did I say? I can't remember.
I think it's the 12th of May.
Yes. Okay.
We think it might be the 12th of May, 2015.
Okay, my name's Doreen Alexander. We're in Vancouver, out at UBC, and it's May the 12th, 2015.
So, Doreen, just before we go any further, was Doreen Alexander your name when you worked at Valleyview?
Yes, it was. Yeah.
Okay, okay. So I just thought I'd just get that cleared up if that was, if there was, so if I see you in a record, though, Doreen is not the most common name in the world.
No, it isn't.
Yeah, though I have a sister called Doreen. So
oh, good.
There you go. Yes. So do you want to just sketch out your life until you entered music therapy? Previous work experience where you grew up, stuff like that?
Okay, I grew up in Edmonton, Alberta, and came from a family of 3 girls. We were all involved in music. I say my sisters were more talented than I was. But then I got married, and we moved out east to Mexico, up to Flin Flon, Manitoba, and then out to the coast, and had 2 children. I have a daughter and a son, and I stayed home while they were growing up. And then when they got to the age where they didn't need me after school anymore, I decided to take a few courses at Pavilion College, and so started taking a few music courses, and before I knew it, they'd started a music therapy program, which sounded really interesting. And so before I knew it, I was enrolled in the music therapy program, which was a 2-year program at the college at that time. It gave you a diploma in music therapy. That's kind of my education.
So was it, I think you were in the 3rd graduating class?
The first. I was in the first graduating class,
okay.
Yes.
So what year was it that you started, and when did you, so it was a 2-year diploma?
Yes, it was. And I think I graduated in 78. I tried to look back, but I couldn't, because we moved, I couldn't find my things. But I have a feeling it was 76 to 78.
And what do you remember about that program?
I remember it was quite bizarre. For, I was in my late 30s, 40s, a conventional kind of mom, and going back to school with these young kids was really an eye-opener for me. And then some of the music therapy studies, they were a little edgy, and so it was really an eye-opener, I have to say. I had to get over the fact of going into the classroom and not straightening up all the desks before the class started, or cleaning off the garbage. It was, I used to do that when I first started, and then finally I thought, I don't think this is appropriate. But yeah, it was quite a change for me.
So you said edgy. What was edgy?
Well, some of the, we did some of the European models of music therapy, and then some of the, like the Rudolf Steiner, and then the main teacher, Carolyn Kenny, she was, her area was kind of field of play with music, and so there was just a lot of things that the style was just, foreign to me, because I grew up in the Toronto Conservatory program of music, where you learned your pieces, took your exams, went on to the next grade, and that was a big change for me. And I had taken some music courses at Cap College before that, which were pretty just choir and theory and jazz theory and things like that. And so at least I had a bit of the college experience with the young people. But That's what I found most difficult, I'd say.
And yeah, because so it was a new field, and you just kind of stumbled upon it at Capilano, because I believe that Capilano was the first place in Canada to offer music therapy.
It was, yes. And yes, it just happened that I'd taken 2 years of not full-time courses, but just, a few courses, and they were starting the program, and one of the profs suggested that I might be interested, and so I looked into it and thought, hey, this looks good. And it was interesting. And of course, the populations you work with, I was interested in children, actually, was what I thought I would work in. But I ended up working with adults.
So, do you remember, like you talked about Rudolf Steiner and the, I guess, anthroposophical kind of take on music. Were there other kind of big key texts or people that you remember or big or important ideas about music therapy from?
Well, one of the other ones was the psychotherapy model of I can't remember the fellow's name in the States. We kind of drew from all areas of that were out there, because of course in Europe music therapy had been practiced, and in the States there were quite a few universities that were providing music therapy. So I would say most of the American colleges and universities that provided it, it was a more structured program, and Cap College seemed to be just a little less structured, because it was including a lot of different styles. So that was probably.
So how many faculty were there?
Just 2. But we
Sounds
did,
like my program.
yeah, we did take courses like in psychology. We'd go to the psychology department, and the music. You still had to continue music, so there would be other music. The music faculty was quite big at that time. Well, not big. I mean, it was in one temporary quarters at that time. So it was very new. Yeah, Cap College was quite new then. I don't know when it started, but.
And sorry, what was? Oh, so your fellow students, they were younger than you.
Much younger.
And given the change at that time, they must have seemed like a different breed.
Yes, exactly. They were. I mean, that was the hippie generation. Let's face it. They were very easygoing. Different lifestyles. They lived in kind of communal houses. It was quite shocking, actually, for me, being, the housewife, suburban housewife kind of lifestyle that I had. So yeah, it was. I can remember many discussions about, the differences. They didn't really relate at all to my lifestyle. Obviously thought me very square. But, there were some of the students, like Liz, there was a few students, Liz and Carrie, who I became quite good friends with. And there was one other older woman. She dropped out, though, sadly. But yeah, in the first class, there were a few people younger than I was, but not really the young.
Yeah, because someone like Lori
Greenwood
really, I'm trying to remember, but I think she did 1 year of university. So she's almost my age, I think.
Yeah.
I was born in 1959, so I think she's maybe 57 or something like that, which is. You were born
much younger.
What?
1940, yeah.
Yeah. So, and you'd have that life as a stay-at-home mom.
Yes.
And then to go back into that environment.
Yeah.
And I would guess that alternative people would be attracted to the newness of the program.
Yes. Oh, exactly. And musicians, musicians are kind of a breed of their own anyhow. And so it attracted an interesting group of people. I don't remember how many were in our graduating class, but not very many. Maybe 10 graduated that year.
So, and I just should ask you, what instruments, or are you a voice person?
Well, I was piano and voice, and then I did learn to play the guitar, but I wasn't great on, reed instruments or anything. But yeah, so that was my main.
You have to learn to play the guitar.
Yes, I know, exactly.
New buddies. Okay, so here's one of my kind of promising practice questions. You said you were interested in working with children. So my question is, could you speak to the potential of music therapy in geriatric mental health as a promising practice? And this is a tall order, but if you could be thinking about then and then your subsequent career, I'd be really interested, because you did go on to work with a geriatric population, and the ideas that you got in school, and how do they map onto really working with elderly people?
Well, it's so natural. Music is such a normal part of everybody's life, and I always felt it was very strange that things that in your normal life give you pleasure and happiness and lead you onto, a little different look at life. When you're hospitalized or something, all that's taken away. So it's like the things that would make you feel better, they've taken away, and yet you're in a healthcare facility. It's kind of strange. So what I found was almost everybody relates in some way to music, to different kinds of music, in different ways. And there's just so many things with people. Your whole lifeline, as a young person, you learn the little skipping songs, and then as a teenager, you've got your favorite songs. And even, it was forever thus. During the war years, look at those war songs are still going on. And so people love to sing, they love to listen to music. Then there's people who love classical music, there's people who love the Western style. So there's so many things you can do, even if there's a listening program that gives people pleasure, nurtures their soul, their body. I found that just everybody related to music in some way. I never met a person who didn't. Never. Some tried to say they did, but.
So you graduated, and you're, now you've got your professional qualifications, and you figured out how to take care of your kids.
Yes.
They figured out how to make their own lunches or something like that, and you wanted to work with children. How did you end up at Valleyview?
When I graduated in April or May that year, there was a special program offered by the government for summer students to do, like a 2 or 3 month summer program. And Valleyview, obviously, the money was made available to them. And so the gal that was doing the program, the recreation program out there, thought music therapy. She'd been to a few music therapy workshops, and she thought music therapy would be great. And so I don't know, somebody suggested me that it might be a fit, so I went out, and that's how we started. So I did that summer program, and it was kind of funny because I was expecting my last day. I was all set to say goodbye to everybody for the last day when that 3-month period was up. And people said, "What do you mean, where are you going?" And I said, "Well, my program's over." They said, well, no, you can stay on. It was like they completely forgot to tell me that the funding had been extended, and so that's really how I started. And I started, doing programs for the people at Valleyview, and there was quite a diverse population there. There was those who were really ill, bedridden, basically still in the main hospital, and then there was a series of cottages. I don't know how 7, I think, which housed people with. I think they kind of grouped. Like one was a woman's group, and one was man. And I don't know if they were mixed. Yeah, some of them were mixed too. But so they were a little more open. Those people had a little more freedom, were able to walk. I don't know if you have talked about the physical aspect of Valleyview out in where it is, but it's a beautiful setting out on the hill, lots of areas to walk, and these cottages were set around the main hospital building. So I had some programs where I went to the cottages, and some where the patients came to the main area. And we started, really simple with the listening programs. And one of the things that the nursing staff, I think, found really hard to get used to was to involve people in a way that they could be involved in making music. Of course, the instruments that you're going to use are pretty simple, basic tambourines, the wooden sticks and things like that. And in the beginning, people thought those quite childish because, of course, they're used to the little kids playing. So that was a big hurdle to get over. That it's not childish to play along to some music. And that was a big hurdle to get over to. Even the patients who weren't used to anything like that. The music that they had was quite interesting. The minister, the pastor, the chaplain, at that time, part of his way of interacting with the residents was to take along a little portable record player. I mean, can you remember when they were just square? And take that along and play, some music for them. So he felt quite worried that I was going to take over his playing of music. So I had to kind of win him over. And then there was the barber who played guitar sometimes, and for special occasions they would do that. And so he valued music too, but didn't realize that it could be so valuable for people. And there was various staff members who were involved. The doctors, for example, were European. 2 of them. One was Czechoslovakian, and I don't know where the other one was from. But they were involved in classical music. They knew that music was really valuable, but just somehow didn't realize that it could be such a valuable tool for people. So part of it was winning the staff over. And having them appreciate that the programs were quite designed to be, simple, to get people involved in the beginning. And then, of course, as things progress, you can get more sophisticated. It's much better today because there's been an ongoing programs in some places. Thinking about the, doing in-service and for staff to let them know the benefits of music therapy. And sometimes they acted very childish. And so it was getting through that. Even though one of the big things that the rec staff did was they had to dance every so often. And you see the
Okay, so I'm going to now be constantly
Looking
looking
at
at this to see if it's
going.
and slowly pulling my hair out. Okay, so I'm just curious. Well, it's fully
Charged.
so I don't know, but we will just
Continue.
don't worry. All
Okay.
the good bits will be kept. So I'm wondering if you could tell me a little bit more about the patient population and the patients themselves.
Okay, I'll start with Cottage 7. That was a group of women that that taught me a lot about how to interact with patients, and taught me about people. And the biggest, like one of the most memorable days was we had an English gal there who loved music. She spent all her life in music hall playing. She was a pianist, and she was a music hall pianist. And so I did a lot of work with her, and one day I arrived to find that she had died, and it really broke me up, because I guess I hadn't been expecting it for some reason. And so I burst into tears in the hallway, and some of the other ladies were there at the time, and honestly, they were so caring. They took me in. The patients, they made me a cup of tea. We sat down. They scrounged around, found some cookies, and it was really a lesson to me to say that, you know, we shouldn't always be thinking we have to take care. We should give people a chance to take care of us sometimes too. And so that was kind of one lesson. Those ladies were really lovely. We had lots of fun doing music programs. We did a lot of listening, but a lot of singing and just discussions about, as you do with music therapy. I mean, the music presents a way to communicate, and so sometimes you can get into verbalization too. Sometimes you can't, but depending on the group. And that reminds me of another gal who was in the hospital. She'd been a seamstress, Italian seamstress all her life. She was bedridden, and she had, persistent movements all the time. Like you could see that she was bringing a needle and thread through material. And she was right outside the nurse's station, actually. And this was a really old-fashioned nurse who did an excellent job. I mean, those people that worked, the nursing staff that worked there, you have to really give them kudos, because what a hard job that was. But anyhow, I learned a little bit about her past and found out that she was a churchgoer, and so started doing a few hymns and things. And the nurse who was sitting outside the door was watching us, and all of a sudden it seemed to break through this constant movement of hers, and she started singing along, not loudly or not energetically, but just kind of mouthing the words a little bit as we went. And that was kind of a breakthrough for the nursing staff too, so that was like another support I gained. And it was just these little instances that people were brought around to the fact that music and creative therapy, like not just music, because one time I was in one of the other cottages, and it was springtime, and so we were doing poetry, and I brought out the English poem. I can't even remember the name of it, but it was "Oh, to be in England now that April's here," I think it is. And so I read that first line, and one of the patients sitting there just repeated by memory the rest of the whole poem, which again set the nursing staff off on, oh my gosh, where would she know that from? And so that was kind of another little bonus, because I have to say, when I got there, people were really skeptical, really skeptical. They just weren't sure what, they thought it was a waste of money, and anyhow, little by little, things were won over. And I think I mentioned earlier, for a few years after, if I would meet any of the nursing staff out in public, I remember 3 times people apologizing to me and saying, I'm sorry we were so miserable in the beginning. We really realize now what music did for people. So you can see, it was a struggle. It was a struggle in the beginning. And then when Moyra was hired, of course, then things really ramped up. And by then people have obviously appreciated the value of the creative arts.
Of course I want to get to Moyra. And I'm getting the sense that what you're saying is that your main opponents,
yes,
the people you really had to win over were actually the nurses.
Yes,
not the psychiatrists.
No, not the
psychiatrists. Because they were these Europeans that had a music thing happening.
Yeah.
But it was the nurses and
there was one American doctor, Travis Simon, who sadly was ill, but he was very supportive of the rehab programs. So he didn't need to be won over.
And was there kind of and was there any sort of friction between, there's quite a distance between PT and music therapy.
Yes.
Yes. So was there sort of a divide within the therapies?
Well, there was a bit in that we used to have, I think it was monthly in-services kind of amongst the rehab staff. And so if we ever did a music activity, a group music activity, it was like, yes, the physios and the podiatrist, she was a podiatrist, we'll call her, and the chaplain, the beginning until then he retired and they hired it. They were very skeptical and uncooperative and didn't really believe that anything, they thought it was just kind of a bunch of new age stuff. So yeah, it was hard in the beginning there, even amongst the rehab staff.
Okay, so am I right in thinking when Moyra came, things really changed?
It did. Now, there was an OT, I wish I could remember her name, Sharon, who was very supportive of the music therapy program too. She was an ally. She became an ally for me. And she was pre-Moyra also. So there was, a few, like there was Linda and Sharon and I, and a few of the nursing staff who really realized, every time something happened that surprised them, that gained another person. But of course, Moyra came in, and by then, the administrators, if you've got administration on your side, and then it was working through the nursing staff, because they, as I say, they'd been there for years looking after these people. And
so was Moyra brought in to start to grow the program?
I think so, yes, yeah.
And so tell me about Moyra. First, do you remember the first time you met her?
Yeah, I remember the dark black hair. She dressed, her physical appearance was like she was right there. She was dressed colorfully, and she spoke very clearly, and you knew when Moyra was in the room. I just remember that. And if Moyra was on your side, you were good. You were good. She would support you and stand up for you, and very, like, I remember one incident. The pianos. There was lots of pianos out at Valleyview. Some of them were in tune, some of them weren't. So I wanted to put in a requisition to have the pianos tuned. But I thought before I did that, I should find out like how much it would cost to have a piano tuned. So I got the name of a piano tuner, and I phoned, And I left a message because they weren't answering. Well, somehow the message got all garbled, and this piano tuner, all he heard was that it was Valleyview Hospital. So what did he do? He phones back and he phones he gets the administration and gets the director and said, somebody was calling about having the pianos tuned. And the director was not pleased. He came storming down to the office, to Moyra's office, and said, and if anybody's going to have the piano tunes, it's not anybody's job here. I don't know what happened, but So then Moyra calls me into the office, and I'm trying to explain that I was just getting a price. I wasn't hiring a piano tuner. I was just getting the price so that we could put in a requisition. Well, it was one of those incidents that was totally embarrassing because, of course, in front of everybody. And Moyra, really supported me and tried to explain that this was what we do. We find out a price before we put a requisition in and thing. But she was so supportive of all the programs. And during that time, also, there was the government must have been doing some reassessing of care, because I can remember a few times of somebody coming in from the not from the government, but hired consultant company coming in to check things over. They were also very supportive of creative therapies. And in fact, the one fellow I remember insisted that I needed a cart or something to carry musical instruments around, so he made sure that they built one for me. So there was something going on.
Was this the days of the NDP?
78.
No, it's too late, isn't it?
Yeah, I think it is.
So I can look for that. Yeah, that would be interesting. I mean, I know that there was a report on Riverview, I think it was called the Folks report on maybe on more healthcare, and they looked at mental health. Anyways, I can look for that.
I remember
that. Because, it's really clear to me that Moyra came in and things changed. People changed, didn't they? Because that difficult chaplain, I'm guessing that he was replaced by Glenn
Yes.
Ross?
Yes. I think he retired. It was
Right.
probably, maybe, he was quite elderly. But yeah, so there was replacements. Moyra did. She hired a whole department of rec therapists, so there was 2 rec therapists plus a couple of aides, I think. I think she hired a couple, OTs, for example, the OT, instead of having just one OT, there was, I think, 2 or 3 OTs, and the workshop kind of went by the wayside, and the more OT programming went in. So, yes, she really revamped the whole thing.
So what do you think, if you could, as best possible, put her vision in words, or her master plan? Do you have
Well, she cared deeply about the patients, and the way they were treated, and what was available to them and what wasn't available to them. And, I think she saw, and this is putting it bluntly, but from a warehouse to a care home. I could see her thinking that this is what she was moving everything to. Because basically in those days, still, they were just housing people and taking care. I remember the barber telling me that I shouldn't be so critical of what was going on, because he said, it was just a few years ago that they didn't even eat off tables, that they just put the food in kind of a trough kind of thing, and that's how people ate. And it was so I guess they thought that was progress. They were moving up. And people, people weren't educated.
things changed
Yes,
in
yeah.
the 60s and
Yeah.
70s, or after the Second World War.
Yes,
There were changes
yeah.
in attitude. And
Yeah, thank
Um,
heavens.
yeah. Now I'm kind of jumping around here, but I don't want to. I wanted to ask you where the patients came from. Like, did they come from the general Riverview population, or were they coming from the community and entering Valleyview?
I think they were coming from probably both places, but I would say mostly from the community. And not just the lower mainland community, but probably, you know, all over the province, because there really weren't other facilities for people at that time.
And did you get the impression there was sort of an equal number of men and women?
I did. You know, I'm trying to think. I would say, I mean, I could be wrong about that. I don't, you know, really, I don't know. I know that I dealt with an equal number of, you know, there was men involved in the program and women involved in the program.
And did you, like, were there patients that you didn't work with because they were too, you know, sick?
Oh, yes, yes. I mean, well, for one thing, I was only one person, and I was only part-time. So, two things. So, I don't know how many patients were in that hospital, but there were a lot. I mean, in the hundreds there had to be, because there was the hospital facility itself. I didn't work with those patients a lot because they were bedridden, and I would have to go up, and I did do the one ward. So, yeah, I worked mostly with the cottage people, and those were people who could manage, like were dressed and socializing in some way. And so, yeah, there was lots of people I didn't work with.
And the ones in the cottages had some mobility.
Yes, definitely.
Yes, so that they would be able to.
Yeah.
Did they eat in the cottages? Were the cottages like their homes?
The cottages were their homes, but I'm trying to think of whether they came to the dining room. No, I think they probably ate in the cottages. Yeah, because there was kitchen facilities, and I think the food was delivered to them.
And if you,
Sorry.
I mean, this is before the, you know, now we have a much more complicated understanding of dementia and Alzheimer's and stuff. But if you had to put a label on the patients you were working with, what would the label be?
You know, I think there was such a variety. Like there was a lot in the men's, for example, syphilis was a big part of why they were there. Depression, I know, like extreme depression in the women's section. And yeah, I wouldn't even label it Alzheimer's. I guess it was a lot of other dementias, which are still, of course, around. But yeah, I couldn't really, it was quite a variety of behaviors and quite a variety of illnesses too, yeah.
So that the people that you've talked about, it's really that positive side of music therapy where people kind of open up, and I don't know if you've seen that wonderful film that's on Netflix called Alive Inside.
Yes.
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 So it's that kind of people opening up. But at Valleyview, did you also use music therapy to deal with anxiety then and aggression?
You know, we weren't, I don't think we were as sophisticated enough to, anxiety we did. Like I did quite a lot of listening, especially using classical music for patients who were anxious. And but aggression, I didn't really do anything with aggression until I moved over to UBC. So they were, I think, more protective of the patients out at Valleyview. If you had an aggressive patient, they were removed. That's how they handled that.
So I guess I'm thinking that a couple of things here, that you had your recreation therapies for some of the patients out at Valleyview, and That was mostly me. That was me talking. That's good. It's going to kind of, so, I mean, you've talked a little bit about this, but I'd like to talk a bit more about how you and how Moyra managed that recreation therapy model versus the nursing or medical model of care, because Moira's coming in and you're telling me she's hiring a lot more staff and she's kind of revving up the wreck engine.
The forces, yes.
Yes. And how did that play out?
I think she was very clear about her mandate, and also she was very clear on how to do in-servicing. So she introduced programs, in the proper way. She would do in-services for staff and kind of try to bring them on side. And by then, people were warming up a little more to what could be available to these people other than just nothing, and what was good for physical, their physical health, and because a lot of them were ambulatory and looking for things to do, and so I think she did it. She obviously did it the right way, because her program, I left shortly after she was hired, but I know her program was very successful after that.
Do you think that what was happening, what was happening at Valleyview was, I'm thinking that there was that the way you related to patients was as a professional, which of course you were, was a little bit different than how a nurse might relate to a patient as a professional. Do you know what I mean?
I think so, because because we were able to be more personal, with patients. It's not always the authoritarian. I'm looking after you, this is what we do, practice. So, that's the thing about music therapy groups. It's often on equal basis. You're in, working in a circle kind of thing, so that you all have a say. Important things like that. There's some choices in your program. For example, I always tried to give a simple thing like putting the instruments on the chairs before people came, so that they could choose which chair they wanted to, instead of handing out instruments what you thought might be good. And even, I remember at UBC doing programs with wheelchairs, and even putting like different colored paper on the floor and having people being able to choose exactly where they wanted to sit, rather than you're here, you're there. Things like that, where people just have no choice in anything. So you start with simple choices like that. So I think there was a change. Moyra certainly brought in a big change. That Valleyview was probably the last resource for patients in the whole province, where they could be sent. So it was a pretty hard place to get around. But Moyra's vision, Moyra had such a soft heart, and yet she had a good sense of how to do things and how to accomplish her goals. So that makes a big difference, I think.
I get a sense that that she was very empathetic.
Yes, she was, yeah.
And that she tended to try to organize services, which I think you did too, from a patient-centered perspective.
Very much so, she did. She didn't have the feeling that you need to be a professional, so you need to appear in a certain way. She really treated everyone as a person rather than a patient. That's a big thing. These were all people living in a communal setting. And she was able to see that and to see, you know, some of the different needs that needed to be met. And she had the ways to meet them, you know, with her programs. She had quite a few. I mean, she had everybody on side there. Because she had everybody, other than nursing and the medical staff, the nursing staff, the housekeeping staff, I would say almost everyone else was under Moyra. You know, she had the chaplain. She might have even had the barber under. There was a barber shop there. And so she had lots of input into like every other discipline.
Yeah, I'm just, sorry, I'm sort of losing, there was a little thread there, it was with that. Oh, I know what it was. Did you wear a uniform?
No. That was nice. Because the OTs did, they wore their blue and white, I think it was OT, or PTs, sorry. I don't know if the OTs did too. Did they have to wear something? I can't remember, but no uniform.
So
I just wore, and in those days, like, remember when, well, no, you wouldn't remember, long skirts were, so, and that kind of, you know, the long skirt area time phased out a little while I was there, and that helped a lot too, because arriving at work in a long skirt obviously was not too great for some of the other staff. But that was in the day when you worked for the government, you pledged allegiance to the Queen too, you know, in order, when you were inducted into the government service. So it was very rigid, yes.
So you would actually, the music therapist would not only act differently to the patients, towards the patients, but they would look
Yes,
different.
yeah. Yes, definitely. I think that's I always feel that's one of the big things. People don't realize that dress can mean a lot, I think. If you go to work in your jeans, I think that says something different when you're working with people than if you go to work dressed, you know, half decently.
And Moyra, and you said that Moyra came wearing bright colors.
Yes, she did, and she always, I'd say she dressed up. I mean, she looked, that was her. She always dressed well. I can remember her sending home a couple of aides because they weren't dressed appropriately a few times. Young girls whose blouses were down to here or the buttons barely fit. And she would just send them home. And
Oh, that's interesting.
Yeah.
Because so was there sort of a kind of a hierarchy of alternative therapies, in that the PTs were the closest to the nurses, and do you think that?
I think at that time, yes, I do, because the physios had their, you know, they already had their niche at Valleyview, and they were a strong department before Moyra came. And so I would say that, you know, and the physio at that time too was pretty, and it still is, like, very structured. There's certain things that they follow, let's face it, their prescriptions for various ailments, and so yeah, I would say definitely.
Yeah, to me, physio's closest to medicine.
Yes.
Biomedicine.
Yeah.
Like it's like chiropractic.
Yes,
you know,
physical.
It's the body as a machine. And,
yeah.
And then the aging machine is in need of. So. I'm interested in. It's interesting that you don't seem to, in your memory, be really thinking dementia care out at Valleyview. When I was thinking that there would have been a lot of patients with some form of cognitive impairment.
Oh, definitely there were. But I guess because of the nature of music, you kind of go over that. Do you know what I mean? It's because music can reach at all levels. It just becomes a part of your programming, and so you're not treating, as I say, aggressive patients. Really, I didn't work with, and so it's more people, with various degrees of dementia were still able to participate to some level, and so that's the thing about music, is people can participate at many different levels, and so probably I don't think of the dementia level, actually. When I look back, I think of the whole person. I guess the other side of the person and what they're able to do.
Yeah, because I totally get what you're saying, because the thing about music is it doesn't matter if a person knows what time of the day
Exactly.
it is. It doesn't matter if they don't remember what they did 5 minutes ago,
Yes.
because it's an in the moment activity.
Yes, exactly. And there's no right or wrong way to listen.
Yes, yes. So one of the things that I'm curious about, because I got a sense from Joy yesterday, was that sort of like a slight blurring of the professional patient categories, just out with Moyra's work at George Derby, and then at Valleyview. But I was wondering if you were involved in any efforts with Moyra or before Moyra to kind of bridge that institution-community divide.
I would say no, probably not. Community meaning outside the community, or?
Yeah, like outside the institutional community.
Yeah.
Yeah.
No, I don't think I did at that point.
Yeah. And did you work with any volunteers?
At Valleyview, I didn't. At UBC, I always had a great volunteer contingent, which was most valuable.
Okay, because that must have been a piece that Moyra put into place after you left.
I think
I'm
so,
interviewing, on Friday, a woman called Joyce Wright, who went on to work with Moyra after she left Riverview, and she was the volunteer coordinator.
Okay, yeah.
Yeah, so that's interesting. That was definitely, then that would have been something that Moyra, she did that at George Derby, and she
Yes,
set that up.
yeah.
Did you get a sense that there was any, I think of elderly people as and I'm speaking historically, not just today, but that we have been, and we continue to a certain extent be, kind of ageist society, right? That there isn't always, that we don't always consider older people are elders, people who have, that there's more of a negative thing.
Yeah.
And then I also, because I've done work in mental health, I'm very sensitive to the fact that that's another population that is sometimes viewed negatively. So I think of elderly people with mental health difficulties as almost a double negative.
Yeah, exactly, yes.
And, I wondered if you wanted to speak to that in terms of having had a career working with elderly people professionally.
Well, I think, yes, I do think that it's a double negative in that, just the general comments that are often made, oh, well, these are the old folks, there's not much you can do here. Even for, like, healthcare dollars. I mean, look what happens. Older people go into, extended care where are the cuts made? Always with the older folks. It just seems like there's no effort to acknowledge the wisdom of older people, or their contribution. One of the things that always really upset me was when people die, people that you've been working with, people die, then you read their obituary in the paper, or they have a service for them, and that's when you find out all the wonderful things they did. It was never recognized when they were alive in the institution or the hospital. Nobody knew all those things happened, and it always struck me as really sad that we didn't know this about that person. And yeah, there would be family members that you could ask, but it just wasn't. You never found out about that. You didn't realize that. Occasionally, there'd be somebody who was really important in the community, like a mayor or a university professor or a doctor, and there would be this aura of special care about that person. But the general people, it was like, well, this is just a place for old folks. I think that still prevails today.
And so it was like that at Valleyview.
Oh,
so,
definitely, yes.
Yeah, so if there was one thing you could have done differently at Valleyview, do you want to speak to that? Because I think that's very interesting.
If I could have done differently, I'd have been more aggressive, more assertive, not aggressive, more assertive and more confident about that the music programs were really beneficial, that people really did appreciate them. Because I found that, it wore on me all the time. And I always said when I started there that as soon as I was really having trouble pushing that door open to take the music cart in, then it would be time for me to leave. And so one day, I was going to a certain cottage, I think it was number 3, and I had this big cart, wooden cart, and so I was pushing it up the little hill and to open the door, and I found that I couldn't go in there, and it was mostly because of the nursing reluctance to, incorporate the program and feel its benefits and be supportive. And so that was the day I handed in my resignation. But because I just felt I couldn't do it. So if I did it again, if I could be in charge, gosh, that would be wonderful. I would get rid of a lot of the things, have people more living in a more normal community style living. Still in cottages would be great, but provide, things for them to do, meaningful things for them to do. Because some of them would be able to do even light work, as far as folding laundry. I mean, that would be a meaningful thing, especially for women of that age who kind of like to have things to do. I would just get rid of the institutions, the large ones. The cottages, that's a great idea, I think. And the setting is so beautiful out there. That really, if every care facility could have a setting like that and build on that, that would be great. But yeah, I wish I'd been a little more assertive myself. Believed in myself.
You're a pioneer.
I'll say.
You're a real pioneer. You're like really on the cutting edge, so I think it sounds like you did very well. But yeah, I'm looking at I have a feeling there were, oh yeah. How medicated were the patients?
Well, that was, of course, the big treatment would be medication. That was, I don't know what the medications were because we didn't really get involved. It wasn't like a team effort. We had lots of discussion about teams. That was
Okay, so you were speaking about drug therapy, and I was interested in drug therapy, what you saw versus what was in your offerings.
so definitely the drug therapy was one of the major therapy out there. Handing out meds was really important, of course, and which meant that people shuffled around a lot in a kind of a meditative state, you could say, and often weren't able to show much emotion because of that. So that was a big part. And so when you came in with a creative arts therapy, where people would actually show some of their emotions, nursing staff often, couldn't handle that. And I remember once having a lady, a very sophisticated woman who was European music, classical music was really a big part of her life before she was in the hospital. And so when we would be playing the offering that we would go through, we were going through the classical composers, she would cry quite a bit. And but instead of the nursing, her nursing companion, instead of realizing that that was a great release for her and an expression of her emotions, felt it was a negative thing, and in the middle of a piece she would say, well, I think that's enough, we've got to go now. So it was the feeling that they didn't want to have patients express their emotions because they didn't know what to do with that, I guess. So in the music programs, for example, there was a lot of, we were able to get into a lot of memories, sad, happy ones, expression of just sometimes anger, although not, as I say, we didn't deal with a lot of that. And so I think that was a really creative way for them to work out, to be able to express their emotions. But it reminded me of trying to, so then be a team that treats the patients. And Moyra really worked hard on this, and I'm sure she got it in eventually, but the nursing staff just couldn't see how a music therapist would have any input into how to, as a team member. And not only music therapists, but OTs or, rec therapists. It was like, no, you're just not part of the team. You know nothing, you can't take over. They saw it as us taking over their job, stepping into their responsibilities. And so I know we had lots of meetings about that where, that our input would be on a different level than your input, which is you've always, taken care of the physical side of things and hopefully the mental side, but other therapies can handle other things. But yeah, so they felt quite threatened by this team idea.
So Moyra came in and she started these, would they be a kind of a case planning meeting? Would you be dealing with just one patient at a time?
Yes. That was kind of the
there's a word, but I can't remember.
Yeah, an interdisciplinary team
Mm-hmm.
to do the, I know what you mean too. Been away
Care
from
plan.
it. Yes, a care plan.
So can you describe that, and how did, okay, so I'm curious about the kind of structure that Moyra was creating there, these care planning teams or whatever she called them. And then, I don't know how innovative that was at the time, but how did she sort of, she must have been doing a certain amount of political work.
Yes.
So if you can sort of speak to the kind of the whole that whole thing.
Well, I'm sure she did. I mean, she was very, as I say, very good at keeping everybody informed. And so as far as administration, you know, she definitely would be meeting with the administrators and with the medical team and doing in-servicing within, like, each cottage was independent. The patients in that cottage would be just like, say, cottage 7. So an OT would be assigned to cottage number 7. A physio would be, and I mean, because I was the only music therapist, I did a few cottages. But so she was trying to get more rehab involvement in that kind of thing. Now, because I left, I don't know really how well that went, but I know it was a big improvement. Because I actually did sit in on, I can remember one lady in cottage 7 sitting in on the care plan and the case referral program where so being a part of that, I do remember that one time. So I'm not sure. I'm sure that someone else can speak to
Yes.
What happened in the end.
Yes. Well, I'm interviewing Carrie Burke this evening, so I'm really looking forward to it. I think he's going to be a great interview. He sounded lovely on the phone.
He's a character, yes.
Yeah.
He's a great
guy.
And
he's he's like kind of a blunt speaker.
Yeah. Yes.
He already has some good stories. Just sort of looking at my little buzzwords. I mean, I've got, you know what, one thing that just struck me when you were talking, and I didn't realize this, but it's the way you describe it, it was as if the nurse was there the whole time you were doing the therapy.
It just, in a few instances where they didn't feel like a patient was well enough to come down to a group or for some reason, yes. That didn't happen often, but with this one woman, she always had a nursing staff with her. So.
Yeah. Did you ever work with family, or did you have contact with family?
No, we didn't out there.
Did you have a sense that the patients had family?
No, I didn't. Well, I was never there on Sunday for kind of visiting time, so I don't know. I didn't get a sense that people had family like I did at UBC, you know, where the daughters would visit or the husbands.
At Valleyview, did family only come on Sunday?
Well, honestly, I never saw visitors, so ever. So I don't know when the visiting time was.
How many years were you there?
2 years.
Working, I guess, Monday to Friday, right?
Well, I was only part-time,
Oh,
so so I think I was like 3 days. I was half-time.
And you never saw them?
I never saw visitors, no, I have to say that, yeah. Yeah. So I don't know, I really don't know
Those people are so isolated.
Yes, they were.
You must have felt so good about what you were doing when
Yeah.
you were pushing that cart.
Yes, pushing the cart through the door. Yeah, well, it brought normalcy. I was there, I think I mentioned this on the phone, when about the first week I started, they were having somebody who was traveling across Canada doing reality therapy. And this was kind of the buzzword in those days. And this woman, it was again, here comes somebody with some weird idea. And this woman brought candlestick holders that was kind of her main thing, to introduce a topic with these. She did a group with the women at a demonstration. And it was like amazing. That candlestick holders could bring so much to, because these were people who would have lived through like the 20s and 30s and gracious living, and I can remember, staff again saying, what's going to come next? But it was like bringing normalcy to these people's lives. This is a normal thing. Talk about, what your home was like. But it was that puzzle, like I always said, take away everything that's normal and try to, and then try to get better, kind of thing.
Were they trying to, like, was there a sense that these people were going to get better?
I don't think so. Most of them, no. I think they were there for life. But some of them, like in some of the cottages, they were discharged. So there was a discharge planning group for a few of the patients. Yeah.
So there would have been a social worker. For sure.
Yes, definitely.
Was she an ally?
It was a he.
Was he?
Yeah. Yes. Yeah. He was. Kind of, but he was an old-fashioned social worker. So, dealt with things kind of a bit in an old-fashioned way, but certainly was supportive. Yeah.
Do you remember his name?
I don't. I can see his face even, I don't.
Yeah. And what's an old-fashioned social worker in 1970?
Well, I'd say dealing only just with admissions, discharge, not dealing with the social being of a person so much as they do now, a little more. But, making sure the forms are filled out and that kind of thing.
Was he just Valleyview?
Yes. Yes.
Valleyview.
Yeah. Yeah. Valleyview was very separate from Riverview. Yeah.
Yeah. And the nurses were Valleyview nurses.
Yes.
No?
Yeah.
Okay. And were they mostly women or men and women?
Men and women. Yeah. Probably mostly women, and not a lot, for a big place like that. Nursing staff wasn't humongous. But and I don't really know I don't know how many would be, but I know each cottage had its own nursing staff, and then the main hospital had.
I'm guessing then that each cottage might have had its own character.
Yes, definitely. Yeah, as I say, number 7, the women seemed to be a little more bright, more interested in life, more involved. And I think if there was discharges, they were from that cottage. And then I just can't remember, but it was probably maybe cottage 5. It was men, and that was in a cottage where that first Christmas I went in and we were doing some Christmas songs, and some fellow started singing a Christmas carol, and they had half doors, because all the doors were locked, of course, so they had this half door. And this fellow, just out of the blue, started singing this Christmas carol, and before I knew it, I noticed all the staff were coming over and looking in, and there was this buzz outside, and so when we finished the program, I went out, and they said, that fellow hasn't spoken for 8 years. I said, well, I didn't know that, And so again, it was like, oh my gosh, maybe music is a good thing. Because certainly they had entertainment, like they would bring in entertainment. And I think that's when people realized the difference between bringing in musical entertainment and having a music therapist. At least there was a glimmer there anyhow.
So was your impression that the patients were kind of working class people, or?
I'd say very mixed, because there were a lot of professional people, and and a lot of creative people. I hate to think of that. Like who had been pianists, professional pianists, artists, filmmaker, I remember.
So not marginal people.
No, definitely not.
But probably some marginal
yes,
people.
Yeah.
Just wondering if you worked with if you got the more creative patients.
Well, I think probably because they were the ones that would be interested, and others are still just sitting in a chair.
I mean, you could, if you were just one person, you couldn't have had that.
No, well, so exactly.
Much, right? Yeah.
I didn't have I'd say 2.5 days a week, so I would do 2 programs every morning, 2 programs every afternoon. So 4, 8, 9, 10, say at the most 10 programs a week. And with small groups, like you have to keep the groups quite small. Otherwise you don't really get,
So how many?
maybe 10.
Maybe 10.
Yeah,
Okay.
at the most, yeah.
Yeah. So you were probably, so you did like 10 groups a week, did you say?
Yeah,
Well, still.
yeah.
So you wouldn't see the same people every week, or would you?
Yes, no, you would,
Okay.
but mostly,
Okay.
yes.
Okay.
Yeah, so it would be
So-
like a week, you know, a program that went every Monday morning at 10 o'clock kind of thing.
And would the nurses decide who's going to work with you?
I can't really remember, but I think it was, yeah, I think it was, because I didn't go into the, I think it was,
Or maybe the doctors too?
yeah.
Or I don't know.
There certainly wasn't.
So it was always scheduled sessions, like music therapy was never integrated into daily living of the institution?
No, not at my time at all, no.
I don't know, that would be.
Yeah.
So,
Yeah.
I don't want to forget to ask you about what you did after Valleyview.
Okay.
So why don't we do that? Because I'm interested. You obviously had a whole other career.
Yeah. Well, it was, I came out to UBC and I worked with for 18 years at UBC Hospital, with mostly in Purdy with the older patients, but I worked in psychiatry and I worked in acute care too at various times when money was available. So I continued, doing music therapy programs with the patients out here, and built up, quite a good, I think quite a good music therapy program. Used lots of volunteers, because of course there's lots of students out here who need volunteering hours, and we had a great volunteer coordinator, and so I would say I used about 30 students a week, and they would help gather the patients for the residents. Like in Purdy, they would gather the residents to come down to a music group. Sometimes I did it down there was a garden room area. And I like to do that because I like to get them off the floor that they were living on. But some of the programs were just in their day room area too. So yeah, so I just continued on doing programs.
So you never worked in community mental health then?
No.
Is there music therapy in community?
I don't think so, not that I know of. And, I mean, there might be in areas like group homes.
Yes.
And things like that, but I don't think kind of on staff, like in a community.
So sorry, I don't know what Purdy
Oh,
is.
Purdy is the extended care unit, sorry,
Okay.
extended
Okay.
care.
So you worked with elderly people and you worked in psychiatry
Yes,
still?
yeah.
Yeah.
But most, in psychiatry it was one-on-one with a variety of patients, although I did do one group I used to try to do work with an OT, because it was good to have do things together. And in Purdy, for example, I worked with speech pathologist, and we did music speech program together. We did that for years, actually. Paula and I are still working together, but we're volunteering at the hospice together now because we're both retired.
Is there a hospice out here?
Well, there is a hospice out here, but we volunteer for Vancouver Hospice, which is over in Kerrisdale kind of area. But yeah, so
music's very important in hospice.
yes,
So important.
it is, but I don't think there's much music in our hospice yet.
Yeah, but you know how to deal with a tough environment.
Yes. So Purdy was 4 floors of extended care, and mostly older folk, but a variety of ages that we worked with. And we worked a lot with stroke patients for music speech, Parkinson's patients for movement and speech, and I had a choir, which I loved, extended care choir, which was really hilarious at times.
That, okay, sorry about that, yes.
So I introduced a component of education, music education, in that we would study composers or particular styles of music, and then it would be like a 10-week course, and then the people would get a diploma at the end, and that was really successful for people in a extended care who wanted, to continue to learn, and so the learning maybe wasn't at the level that it would be in other facilities, but it gives you the sense of accomplishing something.
Yeah, it's
So,
like
yeah.
normalization.
Yes, exactly. Yeah.
So, given your, I guess, this is, if the camera works, which seems weird now, it's kind of your opportunity to make a kind of visionary statement, like speaking to people who are going to work in the mental health field. What were the takeaways? What were the lessons? What did you learn at Valleyview that you think was important for practice, like for working with people?
Well, I think one of the most important things is don't always be the caregiver. Let people contribute in that area too. Let the patients contribute in that area too. Number two, I would say another thing is people are people. We all have maybe something physical wrong, or they have mental health problems, but underneath you're a person that deserves respect and should be treated with respect and kindness at all times. And then what I think you find is that then that's the way you're treated by most people also. Another thing is don't be afraid to go beyond, step out of the box, go beyond what's happening, and be for your patients. Really try to put them first, and the word I'm looking for is can't think of. I can't think of the word.
Be a facilitator?
Well, more like a facilitator, yes, but more of a person who promotes your patients, like their abilities, and I always try in patient care conferences and things to present the human side. Really humanize your patients, because in a medical model, it's really hard. They're dealing with physical and mental problems all the time, and so you need to really humanize people when you're working with them, and just really enjoy it. I found that people love music, pick up on what they love. Keep pushing forward, and gosh, it's hard because with the healthcare dollars, they keep dropping programs. Like there's not many music therapists in BC anymore. It's the lowest. Well, even rehab therapists, like rec therapists, it's the lowest number across Canada because of the healthcare dollars. But I think one of the really important things, and I keep trying to tell new students this, and even working music therapists who forget, is you have to communicate with the rest of the team. You have to do your reporting. You have to, do your care notes. Make sure that they get passed around. Do them in the patient's care book, whatever you call the... So make sure that people know what you're doing. Because it's, you know, if you're going to go off in the corner and do something, you think you're doing it wonderful, but nobody knows about it. Nobody knows how that's contributing to the patient's care. That's not helpful. And you have to make time for doing notes. And a lot of people don't realize that. And I mean, I was lucky in that I did a few presentations. I worked with a young fellow out at UBC, and we did a little video. And I happened to, and the volunteer coordinator saw it. And so at one of her presentations, one of her, you know, introducing new volunteers, she asked if we'd show it. So we had the patient came down. He was a young fellow, and he was really proud of himself that he'd done this. And we presented this video. It was 10 minutes long, and the president of the hospital happened to stop by then. So it was like, what a boon. It was just the perfect opportunity for them to see, you know, how important music therapy was. So that's, music therapy was a big part of UBC's program out here for a long time. Sadly, it isn't anymore.
Because of funding?
Yeah, funding got cut, yeah.
So, is there anything that we haven't covered that, I think you've certainly articulated the value of music therapy. You've told me some good stories about Valleyview. You know, one thing I'm not kind of clear. So you would have this cart with your musical instruments that you push around.
Yes.
But was there a rec, like a therapy room that you would use in the main Valleyview?
Yes, there was, and it was the recreation room. So some of the programs I had in that room too. The rec therapist's office was there, so it wasn't always. So if it was people from the, we used to have a band there, and then a program for people in the hospital if they could somehow come down. But otherwise, I went out to the cottage and did the program in their living space. And so that's why I like to have the instruments, the record, you know, the tape player, the music, heaven knows what else, on my cart that I pushed, yes.
Yeah.
Oh.
Yeah, no, that's, yeah, I think that, did your training at CAP, like, did it really prepare you for what you faced when you got to Valleyview?
I don't think so, no. I don't think so. It, you know, it prepared you for how to use music. But I mean, nothing prepares you for going into a facility. We did do practicums, and I did one at Riverview, which was really hard. And then I did one with youth, and I did one with children at the school. So I had all 4 groups of people that I worked with. But I don't think anything really quite prepares you to be on staff and be responsible for like a whole program. But you know, that develops. I think that's true with any group. You know, even OTs, like, sure, they've got their basket of goodies that they know what they should be doing, and physios, they know, but to start something and build, it's an on-the-job learning experience.
But you had raised 2 kids.
Yes, well, exactly, yes.
So now I didn't know you'd been at Riverview. So when were you at Riverview?
Well, I was just there, I just did a practicum,
like a few weeks or something?
just a day a week for a term. So I think it was maybe 10 days.
Yeah, and was there music therapy at Riverview?
No.
So you were.
Fortunately we did it with, it was another person. I had another student, same as I was. We did it together, and that was, I have to say, I went on Monday, We went Monday. And there was a rec therapist there, and he played the guitar. And so we really followed him around mostly, and then did a program, a couple of music programs, you know, when it was organized. But we didn't, I think it was my first semester, so I didn't, it was more of a just following around as to what could be done.
I think there was a place called Pennington Hall.
Yes, yes.
Is that where you did your...
Well, that was, mostly the rec therapists went again to the different areas, but that was a big hall where they had dances, and there was a tuck shop there, and was it bowling alley was there? They had, well, they could set up recreation. Yeah, it was a really lovely facility actually for people. But yeah, and we did, I know the one program that I did do, that's where we did it. And we had a lot of Native young people in that program, so I just remember, like, that was just one session that we did.
Young Native
Yes,
patients?
yeah, there were at Riverview at that time. At least, I mean, by a lot, I would say 5 in the group. You know, maybe there was 8 people in the group. So,
I wonder what their situation
yeah,
was. I wonder what their stories were.
they were kind of like a schizophrenic behaviors. So it was pretty frightening.
Pretty, like, I don't want to make a lot of assumptions, but residential school,
Yes,
schizophrenic
Yeah.
behaviors would
yeah,
possibly be, there might be a
yeah, it was.
connection there. Wow. Yeah, Riverview, most people I've talked to are not so positive about it.
Yeah.
At that time, but it's hard. I mean, I'm sure that the staff there were trying to.
Of course, yeah.
Just,
I don't even, you know, I won't even think about what about it. I tried not to think, but I would come home after Monday and barely get over the week till, you know, maybe have Saturday and Sunday. Sunday night I'd start weeping again about going out. It was so sad. It was so hard. I mean, you just can't imagine.
why was it so hard, Doreen?
Well, the patients, it's so sad. They were really in bad shape. And all the wards locked, double locks. Staff walked around with a big keychain, and you locked them in and locked them out, and it was bad. There was one ward upstairs that was all decorated as a nursery, and these were all adults living there. Yeah, it was bad.
But you went and worked at Valleyview.
Yeah, well, Valleyview wasn't as bad, I have to say. Yeah, it was, I don't know why, like it.
Well, the cottages sound okay.
Yeah, yeah. I mean, they had some really good, you know, for that time, they were working through things. And
Different atmosphere, because it obviously was quite separate.
yes, yeah.
And it could have had a kind of different culture altogether, and people may be kind of negative about the elderly, but they're usually kind
Mm-hmm.
to them.
Yes.
There's a sense that we should be kind to the
Yes.
elderly people.
And I think, you know, like at Riverview, there was Crease Clinic where the extremely acute mentally ill were sent. And, you know, and so that there was all sorts of really acutely ill people there. So I don't know how nursing staff managed, actually. And I don't know, did some of the music therapists work there after? I don't know if they ever really got a music program.
I don't know.
Yeah.
I don't know anything about
Yeah.
about the music therapy at Riverview, but I might not know. But I do know that I understand that one of the reasons Moyra left Riverview was because Riverview was downsizing.
Yes.
And so they amalgamated the two administrations, and that wasn't a good situation for
Oh,
her
okay.
anymore.
Yeah, I
So
can see that.
moved on to other stuff.
Right.
She's a bit of a star anyway.
Yes, yes,
Yes. Yeah.
definitely.
I mean, do you think Moyra was a feminist?
No, I wouldn't. Mind you, you could say, yeah, in that she put forth as women, well, especially dealing with administration and things, and she put forth women's issues quite clearly, and wasn't afraid to get into the area of admin, executives that wouldn't have had women before. So, yeah, probably she was. She wasn't in the sense that she wasn't the burn the bra type, but she certainly, but because she was so focused, let's face it, her focus was.
Yes. Very passionate
Yes,
about
yeah.
what she believed in.
Yeah.
Well, I'm looking forward to interviewing Carrie, and I'm hoping, and interviewing Joyce on Friday, and I am hoping to talk to her son Mark on Thursday morning.
Oh, good, yeah. I tried to find, there was a OT at Valleyview. Oh, gosh. Why would I just all of a sudden forget her name? Who was very creative, and she also came out to UBC, and I worked with her out at UBC for quite a while. And I tried to locate her for you, because I thought she would be a wonderful person to interview, but I couldn't. Nobody knew where she was. She got married, is the problem, and moved up the valley. Yeah.
Because they changed their name.
Yes, that was it exactly.
I was trying to find this Pat Kreider, and I think that's her name, and I could find her in sort of the professional directories. It appears that she plays bridge.
Oh.
But I couldn't, I mean,
Yeah.
she's not in the directory, right? But I would, I'll be back in June, and we have a place on Hornby.
Oh, lovely.
So we spend our summers here. So it's not impossible for me to come back again and interview people.
Yeah.
Did you have any photographs or did you have any stuff? No, you moved.
No, yeah, yeah. I couldn't even find my record that I know I wrote that. And anyhow, the gal's name was Jilly Cornford. If you ever, I'll kind of keep looking, because.
Yeah. So was she at Valleyview? Or
she was at Valleyview.
Oh, what?
Yes.
Was she one of Moyra's people?
Yes, she was.
Yeah.
And she's a very creative person.
Yeah.
And then she also moved out to UBC like years after I was there. And yeah, so I looked in the OT directory, and
Yeah.
I don't know who, if you get to talk to an OT at all, they might be.
Yeah, because OT interests me. I have this good old friend who's an OT, right? And so I was visiting her on the weekend in Victoria, and I said, so give me the scoop. And she had worked at the Douglas Hospital in Verdun, it became the Douglas Hospital in Montreal as an OT. She was trained in Boston. So she was the one that told me that Moyra had probably done OT/PT at
Yes,
UT.
yeah.
And she said, oh, at the hospital, the psychiatrists were sort of like the daddies.
Yeah.
And she said the nurses were like the mummies. And she said, us OT people, we were like the kid.
Yeah.
And I thought, so she said that the dads were kind of distant and detached, but they were kind of benevolent. But she said it was the mums that could be so difficult.
Yes. Oh, well, that's for sure.
Yeah. But it sounds like you did good things, and
Well, it seemed like, when I look back on it, now I can see lots of really positive little things that happened.
Was there anything that really didn't work?
No, not really. I probably didn't try it. because, things like this one group that we had in the rec room kind of thing, and the people came down, and the fellows, and it was like, oh, remember this tall...
Do you want to start? So I was saying something that didn't work.
Okay, and
And you were telling me a story.
I don't think anything like absolutely didn't work, but trying to work with people who you thought didn't want to take part, and so you'd be going kind of overboard to do it. And then walking down the hallway to coffee with this fellow one time, it would be like a real, come on, we'll say Bill, come on Bill, you can, take part a little longer if you want. And no, I want coffee. So this would go on all through. No, I want coffee. Well, we're only going to be 10 minutes longer, Bill. And so then finally it's over, and we're walking down for coffee. I always used to walk down with him. And Bill says, you should have this music program every day. And I said, well, well, that's funny because you didn't really want to stay. Yes, I did. So you never knew exactly how much good you were doing.
With somebody like that.
Yeah, you should have this every day.
So was there anything else that you wanted to say?
I can't think of anything.
We've covered a lot of
Yes.
territory. I don't have any more
Okay.
questions, and I guess if I do, I can always email you.
Sure.
Well,